Now we'll discuss about what is fissure. Fissure is nothing but a small cut over the anal canal which happens after a prolonged straining of stools. If we compare the differences between the piles and fissure, in both the cases bleeding can happen, but there will be difference in the type or the pattern of the bleeding. In piles, there will be drops of blood that will be leaking once the bowels are cleared, whereas in a case of fissure, there will be a small linear cut over the anal canal. That's why patient can appreciate mostly a blood stained stool or a line of blood over the stool. And symptoms wise, patients will experience symptoms in a case of fissure is, patient with a fissure will have more of a pain compared to the bleeding, and he may or may not have bleeding at all, but he will experience pain after passing stool, which may last for half an hour to 3-4 hours or 5-6 hours or the entire day as per the severity of the fissure of the disease. Whereas in a piles, most of the case of piles are painless unless until it is a grade 4 piles or an advanced pile, or if there is a thrombosed hemorrhoid, means if there is this pile mass, if a clot develops within the pile mass, then it is referred to as a thrombosed hemorrhoid. So for this fissure to develop, it takes one single episode of constipation or passage of a very hard stool. So why this fissure develops means, this fissure can be compared to a rubber band. So generally the anal canal exists like this. Whenever we have to pass stool, it opens to a certain extent, and immediately after passing stool, it closes and comes to normal position. So it's just acting like a rubber band. If there is sudden severe tension over the rubber band, this rubber band may break away. In the same way, if this anal canal breaks away, it is referred to as fissure. For this fissure to develop, one single episode or one single day is enough. Whereas for the piles to develop, it takes months or years of constipation together, which all gets pulled up and leads into piles.